Good morning, students. Today we will see about male reproductive system. So in this class we will be clearly seeing about what are all the male reproductive organ, how the male reproductive system is functioning, and what are all the parts, how the sperm is produced, what is called ejaculation. All these things in a detail we will see. So the male reproductive system is consists of seminiferous tubules. It is seminiferous tubules. It's made up of the germinal epithelial cells. Okay, and it's a testis. Testis is which is mainly producing the male spermatogenesis. That's the production of the sperm. And the epididymis. Epididymis is mainly the function is a storage of sperm. And the vas deferens, it's like a contraction of the sperm through the urethra. Some spasmodic, some movements. Okay, the urethra may be the three parts you can tell. So the urethra may be when it is called urethra, it's the like a penile. This is the penile urethra. It's called the penis penile urethra. This is the external urethra. Then it is the prostate gland is present, so it's a prostate urethra. Okay, so this is the male reproductive overall view of the male reproductive organ. This is called the penis and it is a scrotum. Okay, this spermatogod, this is a testis. It's like a pouch, like a scrotum is like a pouch like appearance. Okay, it's like a pouch like appearance covered by the skin, and it's all together from spermatogod where the blood supply nerve, all this passing blood and venous return from the spermatogod. It's in the symphysis pubis. Are you understanding? Then this is a like a two scrotum. Okay, this is a penis. This triangular portion of this penis is called the glans of penis. So the glands, this penis have the ejectile tissues. So it is called the three cylindrical mass. So if you see in this picture clearly, you can see this erectile tissue. It's like a cylindrical mass. This glands of penis is like it's very sensitive area there. Okay, due to the sexual arouse, this one will be the length of the penis will be increasing. Okay, this is the outer structure. It is present in the symphysis pubis, and if you see in the upper thigh of the men. Are you understanding? Okay, this is called the sexual organ of the male when it is developed in an intrauterine age. So in the intrauterine age, it's a testis is developed in a early stage in a lumbar region. Where in the lumbar region? It is just below the kidneys. Okay, then it will be detached and it is descend downwards and detached from the abdominal cavity. Abdominal peritoneum, and it is completed by completely developed and descend, and it is coming to the area where it is by the 8th month of the fetal life. Are you understanding? So if this process is not taken place, very well listen to me, this is already developed in a lumbar region and it is coming to the abdominal cavity and detached from the peritoneum, and it is going to its original position. Okay, so the back is the rectum is present. Okay, so symphysis pubis in the front. Okay, so bladder is also it's there, it's in the front. What's happening here? So if it is not happening this process, it is called the undescended testis. Some of the child born with is not descended, so you have to go for the surgical correction. That's called undescended. So this is the development of testis. Okay, let us see how does it is work. This all started to work after the puberty. What is that puberty? Puberty when it is starting. So the male also having a puberty? Yes. What's happening in the male? So 10 to 14 years, the muscle development, the voice will be voice and the growing area, that the size of this sexual organ will be enlarged. Then the voice and the tone, everything will be changing. The body mass index will be changing. The muscles, chest muscles wall will be, biceps muscle will be very stronger. So these are all the signs and symptoms of puberty for male. If a female, it is okay, menarche will come, menstruation will come, we will very well be knowing the breast development, other thing will be, but obviously you can see the symptoms of this one. But this men development will not come obviously outside or blood or something, but the organ is totally developing. Okay, So once the organ is main function of this organ, what is the main function of this sexual organ? That is called a production. What is producing? Maturation. What is producing? It's producing the sperm. Maturation, how it is maturing. Storage, where it is storing. And what is the delivery? It's called the ejaculation process. Delivery of spermatozoa. Then passage, where it is passing. It is passed through the urethra. You must understand that urine also pass through by and the sperm also pass through by. Okay, we will see in detail about in this class. You can see this is the, like this is the bladder. Are you understanding? This is the penis. Okay, this inside the penis the line is coming. It is called the urethra. Urethra is classified into 3 parts. Okay, this is called the external urethra, penile urethra. These prostate glands are there, prostate urethra. Okay, what is the prostate gland? Prostate gland is situated where? What is the functions of prostate gland? We will see in clearly. The prostate gland is only the 8 gram in weight. Are you understanding? The main function is it's secreting a milky like fluid, adding some consistency, white milky like fluid, adding into the semen. Okay, this is the ejaculatory duct. Okay, this is the epididymis. This is like a scrotum. It's like a pouch where there is the testes are safely presented. So what's the main structure if you have to see? This testis we will see. This is the testis. This is the vas deferens ejaculatory duct and it is going. Are you understanding? And it is joining together. And if you see bladder also coming and joining through the urethra. When the urine coming, this will not functioning, right? Or either one way it will be functioning, but the passage is going to be the same. Are you understanding? So this is the vas deferens. The vas deferens where it is coming. Epididymis, the seminiferous tubules, all vas deferens. The vas deferens is coming and joining over here. Are you understand? It's going backward of the bladder and joining over here. So this is called the seminal vesicles, where this ejaculation, where the sperm is ejected from the vas deferens. The sperm production where it is happening. If you protect, we have to see the cut section of the testis. How the sperm production is happening, please. So how does the sperm production will be happening also, you have to see. How it will be happening. It is all by the like a hypothalamus and the pituitary. Though the organ is produced, there is a problem in our lymphic system. Also the sperm production will be affected. Correct? So what is that? The hypothalamus. Right or not? It is situated below that hypothalamus. There is a pituitary. So this hypothalamus, when the person is attaining the puberty, the hypothalamus will be reduce some hormone. What is that? Gonadotrophin releasing hormone, right or not? So that's only gamete development will be taken place. So once this hormone is released from the hypothalamus, immediately pituitary will be responding. Which pituitary? It is the anterior pituitary which is responding. Say they will be producing the follicular stimulating hormone and luteinizing hormone. When this hormone directly to the blood vessels, what is the main function of hormone? Hormones are going and hitting the target cells. So in the male, which is the target cells, this is the germinal epithelial cells in the testis. Are you understanding? So this is the cells which is producing the substance called the sperm. The process of the sperm production by these germinal epithelial cells, it is called the spermatozoa. Right or not? So what's happening here? This is the cut section of the ovary. This ovary is it's covered by the 3 layer. First one layer is called the tunica vaginalis. It is the outermost layer. Second layer is called the tunica albuginea. That is the just below that vaginalis layer. And there is a network layer which is called the tunica vasculosa. That's a connective network tissues are there. So in this one we have nearly 200 to 300 lobules are present there. How that the breast you are having the lobules. So this will be, and then these lobules is surrounded by this one will be this division is called, this septum is called the division. Then the seminiferous tubules are present. These seminiferous tubules are made up of by the germinal epithelial cells. You know very well these cells, what is the functions of cells, productory function, secretory function, storage function, absorption functions, or the epithelial cells. Here in the germinal cells or producing function is the sperm is produced. So it is going and it's collecting by the collecting tubules, and it is going to the head of the epididymis, where there is a head of the epididymis, body of the epididymis, and tail of the epididymis, where the sperm also will be stored, and it is passes through the tube is called the vas deferens, or the vas deferens, or this vas deferens. From the vas deferens, then you will go to the ejaculatory duct, when there is the sperm will be ejected and it is going to the erected penis, and it is when it is going to the female organ, and it will be ejected inside the vagina. Are you understanding? So these hormones are supporting when the sexual feeling arises, then it will be stimulated, it will be projected, it will be ejected, and it will be coming over here, and there is a coverings of this one. First covering is vaginalis and tunica albuginea, and will be tunica vasculosa. Are you understanding? So these are all the things, and it will be there will be a sperm will be produced, and if these sperms will be collected by the collecting tubules and will be stored in the epididymis, and will be the movement of the vas deferens. It will be pushed back into that. It will go backward and behind the bladder, and it will be joining, and then it will cross. By the time this is called the prostate gland. This prostate gland will be secreting the fluid is called the white liquid fluid will be secreted by the prostate gland. It will be adding the white color liquefy present in the sperm. Nearly it will be contributing to 30% of this fluid is contributing this one. So milky appearance. So each time will be ejaculated. How many ml? 2 to 5 ml will be ejaculated. In the 2 to 5 ml of the sperm, nearly 40 to 100 millions of the sperms are present. This is the sperm, structure of sperm. This is the head and body and the tail. There is a fructose is present in here in the sperm. So the sperm have the movement, whereas the egg will not have the movement. Ciliary of the mucosa of the tube, only the egg is moving, but here will be sperm will be moving very actively because fructose is already present over here. So this semen will be having 10% of the final ejaculation. Some of the mucus also secreted through the through the urethra, and will be the 30%, as I told you, the prostate fluid will be giving. So the semen is alkaline. Why the sperm number is very high, when whereas only the one egg is produced per month? Because here semen is alkaline, but the vagina is acidic. So many sperms will be losing their life when they cross the acidic way of the vagina, and by the time it is reaching to the tubes where to reach the eggs, many will be dying. That is the sense God has created the millions number of the sperms in the each ejaculation during that time. Are you understanding? But this reproductive function for the female only up to 45 years, but for the men unto 80-85 years also the sperm is continuously produced. If their body condition is good, even after 85-90 also the sperm can be produced. Whereas in the female reproductive system, it is really impossible to do that. So what you have understand about this class? So this is the class you have to mainly write about what is called male reproductive system. Okay, the male reproductive system consists of what is that? Sex accessory glands, okay, testis, epididymis, right, vas deferens, urethra, penis, and the scrotum, or scrotum, penis, urethra, vas deferens, epididymis, testis, or accessory glands. Accessory glands also very helping the seminal fluids to produce. So this is also very important. And where is the position it is present there? What is the development of this in the intrauterine life? How this test is being developed and how it is being descended. So from the lumbar region to abdominal cavity, then it is coming to its original place, and the penis is present in front of upper portion of the thigh. Back side is called the rectum is present. Okay, then you will be then hypothalamus and some of the hormones are playing very important role in the sperm protection. Okay, these hormones are when the hypothalamus releasing gonadotropin and the anterior pituitary will release two hormones. These two hormones will be targeting cell seminiferous tubules. So this is called the germinal epithelial cells. These are producing the sperm in the testis, and these are many lobules are there, seminiferous tubules and collecting ducts. Then sperms are stored in this place, and through the ejaculation it's coming to the vas deferens, coming to the ejaculatory duct, and then mixing with the prostate gland, and it is coming, it is ejected, the sperm. Are you understanding? What is the main functions of this male reproductive system? Mainly production, maturation, storage of spermatozoa, and delivery of the sperm through passage through urethra. What are all the parts of urethra? Urethra may be when it is crossing over this urethra is when the prostate gland over, this is a prostate urethra, then it will be like this is the external urethra. Are you understanding? So it penile urethra, it's in the penis is there, so you can tell penile urethra, and it is the prostate urethra, penile urethra, the glands of the penis. What is called gland? The triangular portion in the sensitive area of the penis is called the glands of penis. This is the area, it is the external urethra is present. Are you understanding? What is called applied anatomy? Applied anatomy, sometimes we are doing a circumcision, right or not? This is a foreskin, it's covered the penis, it will be go back. Sometimes some religious people will do the surgery to removal of this foreskin, is called the circumcision. Sometimes it's the infection. What is this infection? It's called the orchitis. What is called mastitis? Mastitis is inflammation of the breast. Then what is called, already I told you, undescended testis. And then hydrocele. What is called hydrocele? Hydrocele is nothing but the glands are enlarging. 8 gram will be becoming, when the age is increasing, 45 or 60 gram. The this one. Are you understanding? Hydrocele. That scrotum will be enlarging. Tumor. Tumor will be the benign tumor or benign or malignant carcinoma will be occurring. Gynecomastia. What is called gynecomastia? The male is having a female breast, bigger breast is called the gynecomastia. All these happening because of the hormonal problems of the men. So this is about the reproductive system of the male. So you can conclude, or any questions may come. The questions may come, a short notes on male reproductive system. Any one diagram you write and explain the function or the functions of female reproductive system they will be asking, or what is the 2 mark they can ask for what is called sperm, draw the structure of sperm, or the short notes on testis. What is the arteries and blood? Sorry, I forgot to tell about what is this penis. Penis are supplied by the pudendal arteries or penis. Testis are supplied by the testicular arteries. Are you understanding? Testicular vein. These testicular artery, testicular vein are the branches of aorta. Clear? Branches of aorta it is supplying. So this is why blood supply will be testicular artery and the testicular vein, and the nerve supply, if you see 10th and 11th, the thoracic nerves are mainly supplying. Clear? So this is about the male reproductive system. Thank you.